Hi there, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. Today I want to talk about chronic pain, which is something that affects a lot of people. Regardless of whether it's muscle pain, joint pain, whether it's back pain or belly pain, if you suffer from chronic pain, you understand how difficult it can be to even just get through the day. So in our society, the most common way of treating pain is by taking an over-the-counter pain medication, such as aspirin, Tylenol, or Advil. These three pain medications can be good every once in a while if you need them, but they don't necessarily treat the cause of your pain, and they don't necessarily work for the long term. So you do need to rely on these medications over time in order just to get through your day. So I want to give you a couple little known facts about these medications that may sway the way that you use them. So the first is that 4 grams of acetaminophen, or Tylenol as it's more commonly known as, can cause liver damage. And this isn't 4 grams every day for a really long time can cause liver damage. 4 grams just one time in a day can cause liver damage. And this is the dose that can get pretty easy to reach if you're not careful. The second is that aspirin and Advil should never be used together if you can avoid it. A lot of people are taking Advil as a blood thinner, and then they'll pop an aspirin if they're experiencing some pain. Now, these two medications work in a similar pathway, so they shouldn't be taken together because they do interact. The third little known fact is that aspirin and Advil can both cause serious stomach ulcers. They can also cause decreased nutrient absorption, and they can cause abdominal upset or indigestion. One of the big things about stomach ulcers, aside from vomiting blood, which nobody wants to have to do, it can be really, really painful, which then perpetuates the cycle of needing other painkillers. So keep these 3 things in mind. But the other thing is that as a naturopathic doctor, we always want to find the source of what's going on in your body. We always want to treat the cause, because only then are we finding long-term solutions for your health concerns. So as a naturopathic doctor, we're going to try and treat the pain by finding what the cause of it is. So the first major cause of pain can be injury. This is pretty obvious, but muscle strains and overuse or repetitive injuries can be really common, and they can just cause aching and soreness, or they can cause excruciating pain, such as a muscle tear. So, and as a naturopathic doctor, we can refer you, or we can suggest that you may go to a physiotherapist if your pain is severe enough, or to get diagnostic imaging done if your injury is acute. But sort of more as the chronic stuff develops, as sort of I sprained my ankle 3 years ago and I'm still experiencing pain from it, your naturopathic doctor can be very, very helpful in reducing and eliminating that pain. The second is by looking at an underlying disorder for your pain. So pain, for example, could be caused by something like gout. It's very, very painful, so we will treat the reason why you're experiencing gout by changing your diet, doing things like that. Something like osteoarthritis or rheumatoid arthritis, Crohn's disease, migraines, disc disease, plantar fasciitis, all these things are very, very common causes of pain, and each one needs to be treated very individually in order to understand why the pain is happening and eliminate it. For example, if it's ulcerative colitis, we may need to change your diet, heal the gut lining, and reduce inflammation overall in your body in order to reduce the pain that you're experiencing. So again, all these things, what you should be noticing, the common thread here is that you may use Tylenol to treat all of these things, broad sweeping, but that again is not treating the reason why you're experiencing the pain. So the third thing I want to talk about is the biggest and the most important is inflammation. So inflammation is the normal response that your body has when something goes wrong. So your body will send inflammatory mediators, and they're like your little soldiers, and they'll go in there and they'll help to minimize the injury, but in the long term, if you have lots and lots of inflammation, it's going to cause pain. Inflammation can be as overt as having a big swelling in your knee, for example, where you're going to have the redness and the tenderness, and it's hot and it's sore, and that's a big picture version of inflammation. But picture that happening on minuscule aspects inside your body, and that's other places where inflammation can be occurring where you may not otherwise notice it. So inflammation needs to be addressed with pretty much any source of pain. Advil and aspirin both do work in an anti-inflammatory way, but again, you're going to need to be taking those over a long period of time, and they can do a lot of damage. So there are naturopathic things that we can do to treat your inflammation. The first one is we can use herbs. There are a couple of really awesome ones. The first one is turmeric, also known as curcumin. You can use it in your diet, but You do need to eat a lot of curcumin every single day in order to get to those really serious anti-inflammatory levels that we may need to use in order to treat your condition. So your naturopathic doctor may prescribe a supplement that has an extract of the curcumin, and that extract will work as effectively, you just need to take a smaller dose than you would need to eat all that turmeric in order to get the same dose of the extract. So your doctor may recommend curcumin to help with your inflammation. Another great herb is boswellia. Boswellia is something that isn't as commonly known, but for naturopathic doctors, it's wonderful. It helps reduce inflammation, especially in autoimmune conditions or in really serious, severe pain situations. Please, 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 though, don't take these herbs without the consultation of a naturopathic doctor, because they can interact with your medications if you're on any, and they also can cause blood thinning, which isn't a problem in a normal person, but for some people it can actually lead to death. So you need to be very careful with taking these. Please don't self-prescribe. Please talk to your naturopathic doctor about them. The other thing we can do are supplements. So fish oil is an omega-3. Now, omega-3s are anti-inflammatory, and omega-6s are generally pro-inflammatory. And most people with our North American diet, we have way higher amounts of omega-6s than we do omega-3s. So fish oil basically will help to increase your amount of omega-3s, and hopefully we change your diet a bit to also reduce the omega-6s. But basically, this is going to change from a pro-inflammatory state to an anti-inflammatory state. And the way this works is basically the omegas are incorporated into every single cell membrane in your body, and then when that inflammatory cascade happens, your body goes and pulls out some of those omegas in order to make that happen. And if it pulls out an omega-6, it's going to be pro-inflammatory, and if it pulls out an omega-3, it's going to be anti-inflammatory. I'd be happy to do more biochemistry chatting with anybody if they want me to go into it in more detail. I think it's pretty cool, but I'll move on for now. The other supplement we can give you is magnesium. Magnesium is a muscle relaxant, so especially if you're having back spasms or strains or sprains like that, it can help to relax the muscles. But it also reduces blood pressure, reduces anxiety, can help you sleep, and can also promote bowel movement. So please consult your naturopathic doctor to make sure that it's the right type of magnesium. There are many different forms, and each form works slightly differently in the body and can have different effects. So you don't want to take, for example, if you take magnesium citrate, it's going to work on the bowels when you may have been just trying to alleviate your back pain. Other things naturopathic doctors can do are really simple, but they're really effective. The first one is an alternating hot and cold shower. So when you're in the shower, you put it on hot, just your normal warm temperature, nothing that's going to burn you. Please don't do this if you have any sensory loss in the body and you can't notice the hot from the cold. But generally, you move the shower over to hot, you make sure you're nice and warm. You can do this for about 3 minutes or so, and then you switch it to cold. So you want it to be as cold as tolerable. And what I do is I kind of like move around and spin around in the shower so that it's not just like blasting in one place and being freezing cold. But what this does, and then you're going to go back to the hot after about 30 seconds or so of being in the cold. Stay in the hot for 3 minutes, go back to the cold for 30 seconds, back and forth, and please end on cold. So what this does is it causes your blood vessels to vasodilate and constrict. Again, please don't do this if you have any underlying health concerns, because obviously this can cause fainting if you have a heart condition, for example. But typically it will cause just the blood vessels to contract and relax, and it's going to pump fresh blood into places of inflammation and take away the toxins and the inflammatory mediators that we've been talking about. It's really, really helpful. It sounds really simple, but it really goes a long way. The second thing we can do is acupuncture. So acupuncture, similarly to the hot and cold showers, it's going to increase blood flow to the area that we put the acupuncture needles into. Again, that's going to bring fresh nutrients with it and help to eliminate some of those toxins that are in there and help to reduce the inflammation overall. Acupuncture can also be great if you have back pain from tight muscles. It can do trigger point release to help relax those muscles when they're all balled up and knotted. Another thing we can do is help you develop an exercise routine that's going to help to strengthen the muscles around the area that you're experiencing pain. For example, if you have back pain, we may help to strengthen the abdominal muscles so that you have a better supported core, so that your back is able to relax a little bit without being so tense all the time. These exercise routines can also help help reduce the risk of experiencing an injury again in the future. They can also increase your mobility if you're experiencing pain from something like osteoarthritis. So there's also very specific exercise routines that we can recommend. So come on into your naturopathic doctor if that's something that you'd like to discuss. The final thing that we can do as your naturopathic doctor is look at an anti-inflammatory diet to help reduce your pain. So there are foods that are pro-inflammatory in nature, and these foods are typically gluten, dairy, anything that's processed in nature, and anything from what's called the nightshade family. The nightshade family is a family of vegetables, and they include tomatoes, potatoes, eggplants, bell peppers, and cayenne peppers. So all these foods, I know it's difficult to take these out of your diet, but if you are experiencing a lot of inflammation and a lot of pain as a result of that inflammation, again, such as something like rheumatoid or osteoarthritis, this can be really, really helpful for reducing the inflammation and therefore reducing the pain. So pain is really complicated. I hope that this video blog gave you a bit of an overview about some of the things that we can do and gets you thinking about how we can treat the underlying cause of your pain. So please seek care from your naturopathic doctor, and we'd be happy to do that. You can contact me through my website at hillarybooth.com and go to my contact page there and send me a message. You can also send me a message on my Facebook page, and I would be happy to help out. I'd be happy to see you in the office. If you'd like to book an appointment, you can again contact me directly. You can go to my website to book an appointment there, or you can call our office to book an appointment with our reception staff. Thanks so much for watching, everybody. Have a great day.